Yeah, I think we're live on Facebook.
Yeah, just a minute.
Sure.
All right, so we are live on Facebook. Hello, everyone. Hope you all are doing well and safe, and welcome to this webinar. I'm Akansha Sahai, project manager at Rehab Path India office. We are a Madison-based startup with the mission to help patients and families struggling with addiction by connecting them to the right rehabilitation centers. And currently, we are working with around 1,700 rehabilitation centers in India. So in today's webinar, we will be discussing uses of low-level laser therapy for de-addiction with Life Positive Change Clinic. And our guest speaker for today's webinar is Ms. Priyadarshini K, who is the co-founder and CEO of Life Positive Change Group of Clinics. And we have Rajnandani Rathod, who is a psychologist and is also a part of a team, Rehab Path. So she'll be driving the rest of the conversation for today's webinar. This is going to be an hour session, so please feel free to drop your questions anytime on our Zoom and Facebook page, and we will be taking them at the end of the session. Thank you so much. Over to you, Rajnandani.
Thank you, Akansha, and welcome again, Ms. Priya. It's a pleasure having you here. And I am personally very excited to discuss our topic. But before we get into that, could you tell us and our audience a little bit about yourself and your background?
So I'm Priyadarshini. I'm basically a clinical psychologist by profession. I completed my master's in 2014, and then I started working with various MNC hospitals, Manipal, HCG, and majorly handling de-addiction clients there. So when I was handling one of our international de-addiction clients, that's when I got to know about photobiomodulation therapy because she was from UK. So that's how I gained interest, and I'm here today as a co-founder and CEO of Life Positive Change Clinics.
Okay, thank you so much. That was brief, and I really like this bio that you gave your introduction with, and I really look forward to our conversation. And you mentioned a Life Positive Change Clinic. So could you tell us how the journey has been so far?
So Life Positive Change Clinic is just 6 months old. It's a startup clinic which is based out of Bangalore. So here in our clinic, basically we use photobiomodulation therapy in treating de-addiction and neurological disorders. And major clients are from de-addiction and mood disorders. And we have been doing projects as well. Now, since it's a startup, from 3 months, we are doing project with Namans and with various other MNC clinics.
Okay, that sounds a lot for 6 months. Yeah.
So it's just a start, and we are not seeing any OPD clients as much, but it's all research clients.
Oh, okay. That also sounds good. So since this whole topic is new to me as well, and I'm sure to most people in India, let's go ahead and Ms. Priya is going to be giving a presentation on the topic. I'm just going to share it so that we can learn a little more about.
Yeah. So basically, LLLT is an abbreviation for low-level laser therapy. There are other words also which is in common to it. They call it as cold laser therapy. They call it as photobiomodulation therapy, soft lasers, white lasers. Some people even tell laser therapy. So photobiomodulation is a technical term. Rest all are synonyms for it. So let's keep it simple. I will tell it as laser therapy for today. The next slide. So what is the basic principle of laser therapy? So laser therapy works on a cellular level. So that increases the ATP of the cell. ATP is food for mitochondria, basically. Okay, once the food for mitochondria is fulfilled, mitochondria gets energized, and there is cell multiplication that happens from within. So when there is a cell multiplication, whatever degeneration, oxidative stress, age-related wear and tear that has happened within us yields naturally. So basically, let me tell, they tell we have to keep the newborn baby in the early morning sunlight. So basically, what sunlight does is what laser therapy does for older population. So body's nutrition uptake increases, internal healing starts. It induces the dopamine, the pleasure chemicals in the body. So it relieves stress. So on this principle, low-level laser therapy was started in Western countries 40 years ago. And in India, it is 10 years old. The next slide. So the science behind laser therapy and de-addiction. As you see on my PPT, laser therapy helps in activation of ATP, as I earlier told you. And proper mitochondrial function helps in cell regeneration, cell proliferation. And we all know even in the neurons, there is mitochondria. So neurogenesis starts. The oxidation in the neurons reduces, neuron metabolism increases. In de-addiction, how it helps is, it helps in preventing withdrawal symptoms and craving. As all we know how the reward system in addiction works. So it replaces drugs with natural body chemicals. That's dopamine and serotonin. So in the next slide, we can see the pictorial presentation as to how it helps. So laser light penetrates in the tissue, reaches the mitochondria. It enhances the respiratory chain, and there is cytooxidase which happens, which increases neurotrophins, that is and neurogenesis, wherein it reduces the neural oxidation. So you feel relaxed, calm, stress-free most of the time when you're taking this treatment. In our next slide, we can see effect of laser therapy on brains and neuron. So as I earlier told, it increases neurogenesis, the BDNF factor, that is brain-derived neurotrophic factor, is increasing, and nerve growth is enhanced naturally without any medication. It reduces the neural inflammation because it enhances the circulation to the brain, decreases free radicals and oxidative stress. Because the metabolism increases, the oxidative stress decreases, increases blood flow circulation to the frontal cortex. And in frontal cortex, we are aware all executive functions happen. So there are clear sense of purpose, clear thinking, executive skills enhances, reduces body pain by naturally producing body opioids. And it increases the oxygen consumption of the frontal cortex. In our next slide, we continue. So as I earlier told, in the frontal cortex, there are a lot of executive functions that takes place. Along with the pleasure chemical serotonin is naturally produced. When you go back to the reward system, serotonin and dopamine plays a major role when they are on drugs or alcohol, which is naturally produced in a body because of laser therapy. It increases the cognitive function. And improved mood, concentration, reduces fatigue, increases the motivation, endurance, and productivity of an individual. Usually we would have seen most of the drug addicts or alcohol addicts in our rehab center are always drowsy. This gives an instant relief in 1 or 2 sessions. We can see there is productivity in them. There's decreased drowsiness in them. So in our next slide, we can see what happens immediately to the body, keeping aside the brain, what happens to the body of the individual who's taking the treatment. One is relaxation and stress reduction, relief depression, decreased withdrawal symptoms and craving. Any individual who get into de-addiction program, they are motivated to quit. And de-addiction center or wherever they are, the abstinence period is there. After a point of time, they get back. Relapse happens, majorly because of the withdrawal symptoms and the stimulus around and the craving, because body needs that pleasure. So the thing is that pleasure should be naturally produced in our body. So LLT helps in doing it. Clearer mind and sense of purpose, better sleep, less drowsiness, which I told increases the productivity of an individual, increased energy and controlled appetite. Their appetite gets better. Improved bowel functions. And most of psychologists or counselor who's seen this video can correlate. Like if I take cigarette only, my bowels move in the morning. That's how they have connected. So that will reduce eventually once the bowel movement falls in place. Renewed interest and interpersonal and intrapersonal relationship, healthy coping mechanism. So this is an all. In the next slide, we can see why LLT is required in de-addiction. The first one is that it fills the gap between professional therapy and the physical craving. That's the withdrawal symptoms. So it acts like a bridge wherein there are more success rates. Universally, we see the success rate in de-addiction is around 17 to 20%. Wherein Western countries, after using LLT, they promise a success rate about 45 to 60%. Wherein the relapse doesn't happen within first 5 years. LLT initiates the progress of releasing flow of natural brain chemicals. So what happens in addiction, the reward pathway is naturally done with the LLT in the body. So there is a reward pathway still happening without consumption of alcohol or any kind of drugs. And from again and again, I'm telling it reduces withdrawal symptoms, craving, anxiety, restlessness, insomnia, fatigue, cramps, nausea, and depression. The next slide. So people may ask, are there any side effects? So in like de-addiction, LLT was used for de-addiction since last 20 years in Western countries. And till date, there are no side effects that are reported. So what is laser therapy versus conventional therapy? Laser therapy will work like a complementary for conventional therapies. It will not interact with any kind of drugs, what our psychiatrists prescribe. And there are a lot of standalone de-addiction centers which are there in Western countries, which uses LLT in the last 20 to 25 years. LLT, along with conventional therapy, aids a complete recovery of an individual, both physically and mentally, which in turn decreases the chances of relapse, because relapse is something, a major challenge in de-addiction therapies. When LLT is accompanied with conventional therapy, it naturally detoxifies body. So people may ask how it detoxifies our body. Basically, as I earlier told, it naturally increases the circulation, reduces the oxidative stress, improves immune system, whatever toxins are in our body, it is flushed out naturally. So body gets detoxified naturally with LLT without any other extra food supplements as such. So in our next slide, I've put up a few supporting literatures as to how it supports. There are international studies. So first study is on morphine addiction. This was done in 2009. And the next study is in alcohol de-addiction, which usually people were using opioids. Again, drug de-addiction. And today, if you Google for low-level laser therapy in de-addiction or drug withdrawals, you can see there are n number of studies. And one study to quote, which was done in the year 2011 by Rojos Julius, it is a meta-analysis, wherein he is a neurosurgeon. He tells photoneuromodulation therapy, he coined the term, helps in other brain damages and psychiatric disorders, mood disorders, basically, where mitochondria is involved. So this is a brief about how photobiomodulation therapy or laser therapy works in de-addiction. So currently I'm working on 2 projects in Bangalore with one de-addiction center and one with NIMANS, which is going from last 2.5 months. So any other questions as to how it works, what it does to the body?
Oh, are you asking me?
No, the audience, I've just kept it open.
Yeah. Okay. Everyone, you can feel free to drop your questions. Can I stop sharing the slide?
Yeah.
Yeah, thank you. That was very informative. There are a lot of new things that I also learned today. But there are a lot more questions in my head right now. So let's begin with our regular question and answer thing. So what are the different types of equipment that you require for this therapy? And is there any qualification that someone who's practicing this therapy requires?
Yes, definitely. See, we use the low-level laser equipments.
Mhm.
Okay. So there are various range of equipments. So we decide on what penetration level we want, the nanometers. So the penetration into the tissues. So it starts from 630 nanometers and it goes to up to 990 nanometers. Okay, so it is the therapist's discretion to decide. When it is something related to brain, if we are treating the brain, we need about 910 plus nanometers. So if we are treating other pressure points in ears, there are pressure points again. Okay, it is also called as electronic acupuncture in Western countries. So there are acupressure points, wherein again we treat with these lasers, which needs about 650 to 810 nanometers. So definitely, yes, we need a certification to practice this. So in India, there is no institution that is giving certification. Either you have to go to UK. In UK, laser medicines give a certification. In US, there is Therapies, which will give you certification, or Imagine Laser Works that gives certification. Shortly in India, I've been talking to a couple of universities to start the training program. So Indian universities, one is already agreed. So in another span of 2.5 months, we are starting training programs in India as well.
That sounds amazing. That's a huge achievement. Congratulations.
Thank you so much.
So when you say laser therapy, I'm trying to imagine what it might look like. So if I am a client and I come for a session, what would the experience be like for me?
Okay. So this is one simple example which I tell other clients when I'm doing my research as well. If you on the torchlight of your phone and place it on your skin, what would you feel? Absolutely nothing, basically.
Yeah.
After some point, you may feel little heat. Okay, wherein in this laser therapy, you will not feel that heat also, which is why it is again called, some people call it as cold laser therapy. Okay, and you need no protection, special goggles and all are not needed. Okay, so we give it in certain acupressure points and proximal artery, which supplies blood to brain.
Okay. How long does one session generally last? Is there like a time period, or it depends on the patients or clients?
See, there is a time period. So let's say if it is for just de-addiction, to cover all the pressure points, we need about 30 to 35 minutes.
Okay.
If it is any other mood disorders accompanied with de-addiction, it goes about 40 to 50 minutes. And it can be done on OPD basis.
So when I was looking at your presentation, I realized that there are a lot of benefits that even the non-clinical population or normal people can benefit from. So is this something that normally people try to have an experience of or get treatment for?
See, normal people can take about 1 or 2 sessions. Again, untrained professionals cannot administer this. The reason is the basic principle of laser therapy or therapeutic lasers is cell multiplication. There should not be excess cell multiplication as well in the body.
Okay. All right. So coming back to de-addiction, at what stage in the de-addiction treatment process will this therapy help the most?
So basically, here what we do is once there is a client who comes for a de-addiction, okay, we do basic motivation enhancement, motivation assessment, intrinsic, extrinsic motivation assessment, and we see the motivation, and then our counselor starts off with motivation enhancement therapy and then psychoeducation. And immediately we start off with laser therapy. So that the withdrawal symptoms, because if he is a chronic alcoholic or chronic smoker, as soon as he stops, the withdrawal symptoms can range anywhere between 4th day to 6 months. In some cases, 7 months. Initially, he or she will not have withdrawal symptoms. Probably after 3 or 4 months, may have withdrawal symptoms. And in this 4-5 days, there is this reward system that is not happening in the body. Body starts craving for it. So immediate, the better.
Okay. Yeah. So the sooner they get this treatment, the better it is. So is this something that can work as a solitary treatment, or is this something that aids the regular treatment process?
As I told in the PPT, it is complementing the regular treatment. Because in de-addiction, definitely we need a role of a psychologist.
Mm-hmm.
We need a role of a psychiatrist to assess. And it will bridge the gap.
Okay. All right. So my next question is about the duration. In terms of how many sessions does a person require if they are doing this therapy, and how much does it cost on an average?
Okay. So here there are 2 conditions. Suppose if an individual is started using drugs, alcohol, or cigarettes, nicotine, it depends on the duration. Suppose an individual is started just 6 months ago or 1 year ago. As we tell in our psychological term, we tell abuse and use and abuse of it. Okay. So when it is just a use of it, If he is motivated, just counseling will help. If he is motivated, still body craves, at that time he'll be needing about 15 to 20 sessions. In chronic conditions where an individual is being addict for about 10 or 15 years, he'll be needing more than 50 sessions.
Okay. All right.
And it is not on the regular intervals. Initially on regular intervals, yes, and then we'll start monitoring as and when required. But definitely we will follow up the client for at least 2.5 years.
Okay. All right. So on an average, how much does it cost?
We charge 200 rupees per unit. So per unit, matlab, it is 3 minutes of treatment.
Okay.
So if it requires half an hour's treatment, to just multiply.
Mhm. Okay. So how does laser therapy work in comparison to other treatment modalities? And I mean, not just like the medical model or therapy, but also the holistic models like yoga or the importance of nutrition. So where does this stand in comparison to all of these different treatment modalities?
So basically, if you take laser therapy, it is a complementary therapy which happens with a regular therapy. Like how the regular treatment happens, an individual will go for diet counseling, an individual will go for physiotherapy, yoga therapy. So it all works externally. Internally, we have to bridge a gap where we are lacking. What is the reason for relapse? So that bridges a gap. So it is like a bridging thing between conventional modality and contemporary modality. So if we tell nutrition also, we don't know how much the cell is getting, how much the body is getting, the nutrients, how much of dopamine is reduced. So laser therapy will utilize the nutrition to the maximum. Like I can share a study which tells maximum nutrition is taken up by the body once an individual is exposed to low-level laser therapy. Like how in kids, when they are exposed to sunlight, they usually feel hungry, relaxed. And even if we are in morning sunlight or evening sunlight, we feel tired. We need to go back to sleep because there is increased metabolism. The same thing is going to happen here.
So since you also earlier mentioned that this is something which is relatively newer to India than other places, so how popular is laser therapy in the space of de-addiction in India right now?
In India, to best of my knowledge, there are 2 institutions that is using transcranial magnetic stimulation, okay, which uses near infrared rays. A little more advanced, like no one at present is using, but soon they will be using, because there is an Indian study which will come up shortly, probably in 6 months' time. And this is something, to best of my knowledge, AIMS is also studying on this. And they already have 2 papers out, that is in relation to diabetes.
So this looks like a growing field at this point.
It's a promising future.
Yeah, and like you also mentioned earlier that you're talking to colleges to start a program, and I think to be able to start any treatment modality, you definitely need the professionals first. So once you have that, this will definitely take up. So is there any other thing that you can think of that can help rehab centers or other professionals like yourself adapt this therapy?
See, I feel personally, I'm talking to my fellow psychologists and fellow de-addiction centers who are working. You always have to try new things in the market. Be open to learning. So when you learn only, you'll know the pros and cons of a thing. And definitely I will share across the studies. There are a lot of studies that are available on the Google, whatever you're using. So you'll have a lot of studies on this perspective. This is promising and there is no side effects. It just needs about 3 months of certification course. And these machines are OTC machines, on-the-counter machines. You need not have any license as such to buy these machines because this doesn't give you much side effects. Only when you're using little higher range ones, side effects are there. So just feel free for learning. This is something promising technology which will help your clients in their all-round well-being. Definitely, most of the de-addiction centers are having in-house nutritionists, yoga therapists, physiotherapists, and this will give a completion for your therapy.
So now that we're already sort of on the topic, how do you envision laser therapy to grow in India eventually in treating mental health and de-addiction problems?
So when we tell mental health, again, there are studies that is going with Indian Institute of Sciences, NIMANS, and there is another MNC. We are working on Parkinson's patients, dementia, Alzheimer clients, mood disorder, multiple. So this is something which is going to be future. Initially, face-to-face counseling was something. I was personally reluctant for telephonic counseling, and then I had to adapt for it. And now there's something new. I've been adapting and trying to implement in our daily routine of our work. And it has been helpful for me all these years. And I've been working with this since last two and a half years, wherein I was a trainee at that point of time. Now as well, I'm working, I've been telling people, and there are a lot of people who are ready to incorporate. It's just the training that they need, which will shortly start in India as well.
Okay, it definitely looks like low-level laser therapy has a bright future in our country. So I have a question for you. Have you treated any clients that have any de-addiction problems using laser therapy? Or if not de-addiction, then even mental health? Like you said, right now you're working on some research. So what has your experience been like so far?
So I've handled both multiple drug de-addiction, one client, and alcohol de-addiction. I've treated 2 clients. Like I've personally treated, and I have a team, as I told, whom usually we don't discuss our clients after work. So first client, there is no withdrawal symptoms as of now. It's been 1.5 years since we treated him and regularly following him up with. And there's not been relapse anything as such, because I follow up with the family as well. And he is settled. Like recently, I received his wedding invitation as well.
Oh, amazing.
So one successful story, the other 2 I'm working with presently. Apart from that, I've been working with 3 Parkinson's clients, out of which one is grade 1, initial stage with midbrain atrophy. The MRIs, contrast, and all we initially started with. So we are waiting for another MRI post 35 sessions. He completed his 35 sessions today. So we are waiting for his MRI. Again, everything is research based. So there are neuropsychiatrists and neuropsychologists in the team who have been helping me with understand the MRIs as to how it is happening. But personal observation in Parkinson's, there is control in involuntary movements. So handwriting is drastically improved, speech is improved, the mobility, movement is improved, there is body balance, which is again an achievement.
Yeah,
And he's still on
definitely.
medication, and he's still continuing his medication Sindopa. So first we spoke to his psychiatrist, neurologist, and then we recruited him for a study. And the other patient is of grade 3. Again, involuntary movements have stopped. Speech is improving. Again, it is not only laser therapy that is helping. Okay, it is nutrition, physiotherapy, speech therapy, everything is put together. Here, my point in the research is neurogenesis can take place. The condition can be reversed is my hypothesis.
With Parkinson, it looks like um, all of the patients so far have been benefiting. Is my audio clear? I think there's some internet.
Yeah, there is some internet problem.
Can you hear
Now
me?
it is fine. Now it is fine. Hello?
Yeah, can you hear me now?
Yeah, now I can hear you.
Yeah, I think I'll just keep my video off for a minute, so maybe it'll get better. Yeah, so since you also mentioned Parkinson's and other mood disorders, are there any other applications of laser therapy?
Sorry, your voice has been breaking.
Yeah, Miss Priya, were you able to hear me?
Yeah, now better.
Yeah, I was asking what are the other applications of laser therapy?
So one is with mental health, neurological, mood disorder. As I told when I was presenting my de-addiction slides, it will enhance the production of bodily opioids, dopamine, serotonin levels. Apart from that, since the basic principle is cell regeneration, and so it is used as a part of pain management as well. So cartilage degeneration, it can be reversed. Spinal degeneration, spinal cord injuries, traumatic brain injuries. So these all can be helped. And there are 40 years of research studies which are available on Google again.
Okay, amazing. So these are all the questions that I had for you. Let's go ahead and see if there are any questions from the guests. Okay, there's one. How much is the treatment cost and treatment length different from normal treatment programs at a rehab center? I think we've already addressed that, but would you like to answer that?
So we charge 200 rupees per unit. Treatment duration would be somewhere around 30 minutes to 40 minutes. So per unit is 3 minutes. So 3 minutes into 30 or 40 will be your cost.
Right, which is for one session, and
the sessions anywhere may range from 15 to 40 to 45 sessions, depending on client's issue severity.
Right. And this is something that they can do along with their regular treatment at a rehab center. Right?
Yes, they can.
I feel like this is something that should be introduced in every treatment center. Right.
And if you go through studies, there are various conditions now at present. Low-level laser therapy can treat more than 102 to 115 conditions. And definitely in cosmetic industries, they are using, which is little of an higher hand, like the nanometers, or the output of laser is on a little higher side. Hair fall, there are a lot of other cosmetic conditions, neuro conditions, de-addiction, ortho conditions. In fact, fertility is gaining more importance in Japanese country and Denmark. There are studies that is going on. So use of low-level laser therapy in fertility.
So I think laser therapy is more popular in some areas and not, and gaining popularity in other areas right now.
In Asia, it has gained popularity only in Japan at present. Slowly gaining its popularity in China, India, Pakistan. Sri Lanka also has a university for it.
Oh, wow. Okay. There's another question. Who all are the ones who can take a course on this and practice laser therapy? Does it need to be only doctors or clinical psychologists?
Any science graduate can, and who's ready to learn concepts.
All right. I can see one last question. How do you know that the therapy is working on a client? Are there any methods or assessment you use to measure the progress?
Okay, give me an example. Let's take de-addiction. Okay, so first thing is counseling or conventional therapies we follow. The next one is the family observation, how the person has changed. Okay, and there are few clinical assessments which our doctors do, which I can ask them to probably answer those questions. Because since I'm a clinical psychologist and I'm not from a medical background, I can always ask my psychiatrist to answer that question. Can that person leave the contact details?
Yeah, sure. We'll follow up on that. One thing that I forgot to ask initially is about Life Positive Change Clinic. Other than laser therapy, is there any other thing that you're working on or any other services that you provide?
So we provide assessments, nutritional counseling, yoga therapy, physiotherapy, and definitely psychological counseling since I'm a clinical psychologist. So we have been on alternative medicine. And we have in-house doctors who will see the conventional treatment. We will take the holistic approach in healing a client, be it with any condition.
Amazing. Can we take one last question from the audience?
Sure.
Yeah. Can advanced dementia be benefited from laser therapy? I think in the PPT somewhere it was mentioned that it can help with memory.
It can help the memory. Advanced dementia, we can not reverse it 100%. Okay. We can stop it by further progression. And the rest, they can share the case details, my psychiatrist, and we will look into and we will get back to that person.
Amazing. Okay. So that's all the questions that you had. And I really enjoyed this conversation and definitely learned a lot. So handing this over to Akansha. Hi, Akansha, are you here?
Yeah.
Yeah.
Sorry. So thank you so much, Rajnandani, and thank you so much, Ms. Priya. It was really an insightful session, and I'm sure it must have helped a lot of people in our network. Actually, it was something really new. And I too heard about it for the first time, and it was really interesting and nice to know about something new. And I hope a lot of people start adapting and using this technology to help the patients and people. And so before we conclude, do you have any message as a clinical psychologist for the audience, like a general message?
I would tell, be open for learning new things.
All
There are
right.
a lot of things to learn.
Yeah. Thank you so much, Ms. Priya. Very short and crisp, and it was really a nice message. So it was really great having both of you today, and thank you once again to all our audience for the active participation. And we will be back with soon another webinar. Till then, please stay safe and have a great weekend. Bye-bye, everyone. And thank you once again, Ms. Priya and Rajnandani.
Bye, Akansha. Bye, everyone. Thank you. Thank you, Priya.
Thank you.